I have worked in oncology ward for a very long time, and working in oncology has taught me a lot of things about diseases. I recall walking into the ward. There were two young girls sitting next to each other, and they were playing. They didn't have any problems. They didn't show that they were sick. There were no signs of them being sick, but they were in oncology ward. One thing that was really striking for me was these are young girls. What are young girls doing here? That was the first thing when I walked in. Then I went to the chart and I looked at the children's chart and I asked myself, what is the diagnosis for these young girls? They are too young to be here. And when I look at the chart, the diagnosis was colorectal carcinoma, colorectal cancer. I looked at myself and I said, but the guidelines are telling us that you should start screening at age 40s, in the 40s. And it says we must screen every 10 years. So then I asked myself, what is going on? Why am I having young girls in the ward? Then I looked around in the file. When I looked at this children's file, the young girl's file, I checked the age. They are only 15 years old. At age 15, they're presenting with stage 3B, and they both had the same diagnosis and they both came from the same clinic. So these were young girls who knew each other and they came from the same clinic. Now, that made me very concerned. One, concerned that we are facing a huge challenge in our community where we see a lot of young patients coming up now with the diseases. And what we see is a paradox of what the guidelines are telling us and what the clinic is evidently showing us. So the guidelines are telling us that we should screen early, but also it mentions that if you have a family history, you have to go and check before the age that is advocated for you to screen. But then I look around my situation. I'm a Black African woman who comes from South Africa, and my mother is a domestic worker, and we come from the history of apartheid, where Black people were not allowed to even be able to go to the doctor. So my grandmother died not knowing the cause of death. So the question is now, how do I know my family history if I come from such a background of not knowing what is going on, not knowing what is taking place in our society, because of the situation that brought us to this have a family history. What is a family history? A family history is the history of diseases that runs in your family. So in the case of my situation where my whole family was poor, they didn't go to the doctor, and if you go to the clinic, you wait in long lines. How are you gonna know for real that your family history? How are you gonna know what your family, your grandparents had for you to be able to check for the diseases? Because cancer is hereditary. Colorectal cancer is hereditary, and polyps is one of the causes. If there were polyps that were found running in the family, you may have them. So that was the case with these young girls. They had polyps in their colon, and the polyps then changed, which is called metaplasia. They changed the structure from the polyps into what we call a carcinoma. And a carcinoma is a malignant change of those polyps into a cancerous situation. And they are only 15 years old. So the guidelines tells us to screen them when they're in their 40s. When are they going to get their 40s? Are we going to screen them when they're already dead? This is the question. So today I'm doing a tribute to Chadwick Boseman because I felt it was very important for us to address the challenges we're facing in the clinic and in the community. Why is this important to speak about this right now? Is because we community, because one, we don't have resources, but two, we don't have the knowledge. And us with the knowledge are not having enough time to be able to send the message to our people in order for their lives to be saved. My main purpose is to share the knowledge that I've gathered in oncology and my experiences and the patients that I've seen in order to help you live longer. That's my only interest in this, is that you should live longer. You should not die of diseases that are preventable. We see in our community that people are dying of some simple things like diabetes, hypertension. We lose our family members every day of these diseases because we don't check in time, we don't screen. So when I started the nonprofit called Sinomusa Notando Community Development, was to raise an awareness of cancer, but also to provide free cancer screening and healthcare screening. Because my community in Guanyuso, where I come from, we did not have a clinic. We still don't have a hospital. You wait, you see a doctor only once a week. You cannot see a doctor any day you want to. We come from a very background that has limited us to access knowledge, has limited us to access healthcare. So look out for signs and symptoms early. This is not only happening when you are poor. The sad part is that not only the poor people are presenting late in the healthcare institutions, but we see people who are affording, who are our community, our black and brown community, who are affording, who have money, still presenting late at the centers of healthcare because we don't have the knowledge. We don't have this history of and the habit coming from our generations that encourages us to follow our health closely. So if we don't screen ourselves, we don't test ourselves, we don't check ourselves, we don't read about healthcare issues, we may find ourselves dying early than we're supposed to die because we did not screen. They say prevention is better than cure. We have to learn to prevent the disease in order to cure them. Back to my 15-year-old patients. They passed away. I lost the two patients because they presented a stage 3B at presentation. I will explain what the stages are and what does it mean if you are a certain stage. But all I can say is advanced stages of your cancer makes treatment availability limited. So if I was going to give you surgery and then you come with stage 4 cancer, which means it has spread maybe outside the site, it has gone outside your normal site, it creates complications. So, for instance, say you present with a stage 4 colon cancer, there are so many treatment modalities that are available that a person who present with stage 1 will be able to access. Do you see the difference? Do you see the challenge that we faced with? That because you come late, you miss out on opportunities and you actually discriminate yourself from accessing the healthcare availability that is at your disposal. So, now, what is the challenge? The challenge with colon cancer is our diet. That's the main cause. The food that we eat, the habits that we have, like drinking, smoking, has a huge impact on you developing colon cancer. Remember, your colon is part of your digestive system. It's part of the lower GIT tract. Lower GIT is gastrointestinal. So gastro means stomach, intestinal means intestines. It is not the stomach that people say it's a stomach when they talk about the abdomen. The abdomen is the whole part that people look at on the outside. But then the stomach is an organ that lies inside your abdominal cavity. And then the intestines are the small tube that carries the food. But before the stomach is the esophagus, which is a very important part as well of your digestive system. And on top of that, then you have your accessory organs that are helping with food digestion, like pancreas. They also play a major role in the food that you eat and you digest. Gallbladder, there's many other, even the fact that you're chewing food with your teeth, it has a huge impact on how your body digests your food. So food, diet is so key. I cannot emphasize the importance of diet more. Diet is the most important thing that you can do for yourself. When I grew up in the rural community where my grandmother used to plow in the fields. So we did not have food from the shop, but we waited for the season for the meals to come up from the garden. So what happens is if it was not the season for reaping, then we will starve. But during the season of getting the food from the garden, we had plenty of corn, we had spinach, we had all the vegetables that were required for us to survive. So I'm mentioning this because in African context and in African perspective, we did not have things that were of monetary value, but we had things that of natural value. So we plowed on the fields. We ate from the roots of the soil. We ate from the soil, and we drank from the rivers, the water that came from the river. I remember growing up, all I drank was water because we didn't have money for drinks. Drinks were a luxury. But I know there are people who drink soda every day. You drink all forms of soda, kind of drinks, even juices, because we live in a society which is very Western, and our society tells us it is okay to drink that kind of food, to drink that kind of water, that kind of liquids, and eat that kind of food. We eat fast foods, and these are the foods that are really affecting us in a great way. We are changing from even Africans. The research has been showing that even Africans are no longer living in a normal way that the African community are supposed to live by. We find that even us in as Africans are now living the Western kind of lifestyle. And the Western lifestyle has really affected our standard of living and has brought diseases into the community, the diseases that were not there in the past before we changed to a sedentary lifestyle. So diet is very important. Actually, about colorectal cancer, we can talk almost the whole day. That's why I call it a seminar, and it's going to be on series. So if you eat certain foods, they have an effect on developing colon cancer. Why do we call it colorectal? Is because it's a colon and a rectum. I will explain exactly where the colon is after talking about this issue of diet because it's very, very important. You decide to take the food and put it in your mouth. They say you are what you eat because really, whatever you put in that mouth is what makes you. We had a talk recently about abuse because South Africa was celebrating a Women's Month. And Women's Month is August because in 1956 women marched. So we were advocating to stop the abuse. And one of the topics we discussed was ending the abuse amongst the plus size women. And during the talk on the radio station, I mentioned that it is very important that no matter what size you are, you have to exercise and eat healthy. The reason why I was saying this, now this conversation and the one we had is now merging because what I was advising the plus size models is that it's good to be a plus size and be confident because there's a background of hereditary of you gain that weight maybe from your parents or from the medical condition or whatever or drugs that you're taking or treatment. But the most important thing is that watch what you eat. Everyone, whether you're slim or you're bigger size, because the food that you ingest can be the poison for your body or can be a medicine for your body. Just the food that we eat can heal us or can kill us. So I was saying, I'm glad that this conversation now is taking place because we are now merging the communication we have cancer. So now it doesn't matter whether you are big or small. It's because now you may develop the disease because of the food you ingest. Alcohol is very dangerous for your colon. You have to be careful. Actually, it's dangerous for many organs. There's something called alcohol binge that people usually do sometimes on weekends or celebrations or parties or birthday parties. If you alcohol binge, you may develop something called acute pancreatitis. A pancreas lies under your stomach. It forms the stomach bed in anatomy. And that can be a major problem because the pancreas is very difficult to detect. By the time you come to the ER or to the emergency room, you come when it's already too late, or you come when the enzymes are very high and you require an operation. Do you get what I'm saying? That you just went for a weekend and you drank alcohol, then you end up with an operation in your stomach that's going to remind you of your drinking for the rest of your life from developing acute pancreatitis. Same thing on the colon cancer. Diet and alcohol and what you eat is it's not good for you to drink alcohol because it then predisposes your body into developing cancer. It can cause metaplasia. It can cause changes in your structure and the lining of your colon and then predisposes you to cancer. On the issue of diet, the diets that you're supposed to stop is the high fat diet content. If you ingest meals with a high amount of fat, you are predisposing yourself to colon cancer. So what kind of diet are you supposed to eat? Like greens, fruits and vegetables. Also, high fiber diet has been found through research to be preventative of developing colon cancer. So if you take a high fiber diet in your meals and roughage, you may be saving your life and helping yourself live longer. We are not saying that people with colon cancer, they are all eating the wrong food. We are saying one of the causes of colon cancer and developing colon cancer is the food that you eat. It's not the only one. But also, The other causes that are very key is polyps, like I mentioned. What is a polyp? A polyp is a round nodular growth which is benign, that grows in your gut, in your colon. Sometimes it looks like a carpet. That's how much the polyps will be on the colon. They have a look as if it's the carpet is laid down on your colon. It has those ridges and nodular, and it's rough when you look at it. And there are certain diseases that are associated with the polyps, and those diseases can complicate and then become a cancer. So it's not only diet, but also polyps. But then imagine when someone has problems of history, family history of the polyps, and then the same person is eating the wrong food and high fat diet, and then also on top of that, the same person is also taking alcohol and smoking. So you are increasing the chances. And then the chances increase even more if you have a family member who had colon cancer and or died of colon cancer. This is the first degree relative. What do I mean by first degree relative? I mean a person who is your sister, your brother, your mother, your father, a close relative. You stand a very high chance of developing colon cancer in those instances. Also, if there's one or more in your family member who has colon cancer in the past, you have a family member who has polyps or any diseases that is relating to developing polyps, or inflammatory bowel syndrome or inflammatory bowel diseases, you are most likely to also developing colon cancer. So I hope you understand that there are many factors. It's a multifactorial disease, and it tends to be a little bit complicated when it comes to colorectal cancer. I don't think we'll be able to cover a lot of things today, but I want to do series and we'll cover each time. And if you have questions, please leave them below. And don't forget to subscribe so that you don't miss out on this conversation as we go along. Then I ask myself, why are we facing a situation where a 15-year-old, like the patient I had in my ward, is dying before the time we have been told it is the screening time? We cannot, I've never heard of anybody screening a child for colon cancer. It's not in our guidelines that we should screen children for colon cancer. So young girls don't know. They walk around, they playing, and they don't know they could be having these polyps. So my request to you is go back home and ask your parents. Have a discussion that matters in your family. Revive the relationships with your family. Have this conversation, because the family history is very important. The family history can help you live and can help you prevent the future problems that you may develop, future diseases that you may develop. Ask your parents do they know of anyone who died of any diseases that relates to cancer. I've heard that some of my patients, when I discuss with them and I ask them why you are not telling your family members that you have cancer, they say they don't want to make their children worried. And a lot of people have been asking, why did Chadwick tell us that he has cancer? Chadwick Boseman, the one who acted on Wakanda, the movie called Black Panther. And we know the whole slogan of Wakanda, Wakanda for life. It came through him. He's a well-known. He died at 43 of colorectal cancer. And it sounds like it was stage 3. It would have been different, his management, if he was stage 1 than when he was stage 3. But he did not have to tell anyone but his family members. If he did not tell his family, it would have affected his whole generation, because it's very important that his family now and the family of the patient that I mentioned, who the young girls who died in my ward, who are my patients, who died at age 15, those two families need to go and talk to their generations and pass it down the generations, this information. Why? Because it is very important for them to see a genetic counselor. A genetic counselor is a specialist who's designed and trained to look into your family lineage and calculate on and look into who may be predisposed, how can you prevent, and how can you test. How can you test yourself, and how can you test others and your family members to see who may develop colorectal cancer. They can also calculate who amongst your children may develop this, may have a recessive gene of this cancer, or may have a dominant gene of this cancer. Only a genetic counseling can be able to help you with that counseling, in order for you to be able, these are preventative measures. You need to be able to prevent yourself from developing the disease. And the way to do that is by knowing. Knowledge is power. Even the Bible says, my people perish because they lack knowledge. Some knowledge does not come from the doctor. Remember, you are giving the doctor the information. So now, what are the things that you look for to get worried, or to start realizing that, oh, maybe I have a problem with colon cancer? The things that you have to look for is a general body, just your general body. Are you getting tired? Are you bleeding? Are you noticing certain changes in your diet, changes in your appetite, changes in your bowel habits? Are you feeling the pain? Where is the pain? Is the pain in the tummy area? Are you starting to see when you go to the loo and you pass number 2, do you find that there's blood coming in your stool? How much of this blood is coming? Because it also depends on, when you're bleeding rectally, it doesn't mean it's colon cancer. We know that hemorrhoids do cause also the problem of bleeding. So you may be bleeding rectally just because you have hemorrhoids, but you won't know. You need a doctor to examine you. Now, I want to speak to the general community, because I know, I come from the village, I come from the family that developed the habit of not going to the doctor because we didn't have a doctor and we didn't have the money. Then it ran from my family that we don't believe in doctors. This is my family. My family did not believe in doctors. They believed in prayer. My family prayed for everything. My grandmother prayed for her diabetes because she refused to go and be treated badly at the local clinics. And my grandmother died. It's one of my motivation for doing this awareness, because I've lost a personal, very dear family member of mine who, because of lack of resources, gave up on the system and started creating her own beliefs in order to prevent herself from dying. And she started believing that she can lay hands on herself and she can be better. I'm not against laying of hands, and I'm not against going to your traditional healers, and I'm not against doing that you think is right, as long as it doesn't harm you. In the case of my grandmother, her decision to pray for diabetes caused her to die. She died of ketoacidosis, and she died in my hands, and I was only in 4th year medical school. I couldn't help her much. By the time I came to the ER, which I was coming from very far, it was way too late. So this is why it helps to screen early and get into the habit of checking yourself early. so that you know and the family knows what problems arise. Yes, we have challenges in our local clinic, in our community. We don't have resources. Yes, we are black. Yes, we are poor. I understand that. But at the end of the day, there are basic things that you and I can do to control and prevent the challenges that we can be faced with. Some of you will see the symptoms that I'm talking about today and you will ignore them. A lot of people ignore the symptoms that they see, they ignore the signs, and then they die because they have so many reasons. It's COVID-19. People don't want to go to the hospital. I'm scared. I'm going to go to the hospital, then I'm going to come back with COVID-19. I understand. But there are certain things that you can call the doctor about and inform the doctor about the certain health challenges you're facing. If you see the bleed when you pass the stool, don't ignore it. It's serious, even if it's a tinge of blood. But sometimes, if you are constipated, like colon cancer causes constipation and it can cause diarrhea. That's why it interchanges between constipation and diarrhea. If there's any change in your bowel, I know a lot of you will run into taking laxatives. If you know you're eating healthy, you don't have a reason why your bowels should have a problem, and you have feeling right now, there's a certain amount of fullness in your rectum, you feel like you want to pass stools and there's nothing there, you go to the restroom and nothing comes out, or when you go in past stool and there's blood, or there's blood in your tissue, or there's blood flowing, that is not normal. There was a patient that I met who was an elderly patient. She had cervical cancer, but she didn't know. She started bleeding. She thought she was getting her normal periods coming back again. And then on further, when we told her that she had cancer, she was embarrassed to tell her daughters that she was bleeding vaginally. So what she did, she was hiding and she was stealing their kids' pads and using them until she fainted. And they found that she was anemic. She was starting to feel dizzy, and one of the dizzy spells led her to the hospital. This is how she was diagnosed with cervical cancer. All I'm saying, I'm sharing this story with you because I'm asking you not to be embarrassed about the symptoms that you're feeling, about the symptoms that you're seeing. Do not hide things from your doctor, too. When you have a consultation, ask, and do not be afraid to ask. Do not be ashamed of asking about the symptoms that you see. And if there are things that are worrying you, please don't be scared to ask. It is very important that you tell somebody that you're feeling something. Sometimes the abdominal pain can be so severe that you cannot even sit still. Sometimes your body will demand you to react because you've been ignoring it for a very long time. If you have an abdominal pain, don't ignore it. It is very important. I am going to also explain this in Zulu briefly, but it is very important that you watch the symptoms of colon cancer and don't ignore them. I wish we could all diagnose cancer at a very early stage. There was a research that was done in South Africa and it showed that 77% of Black community were presenting with advanced stages of cancer and 33% were presenting with early stage of cancer. But in other Western society, like the Caucasian, the white community, were presenting with very early disease. And like I mentioned earlier on, sometimes it's not the system that discriminates us. Sometimes it's us and the situations and the environment we find ourselves in that discriminates us. Now, what do you do when you see the symptoms? You have to call your doctor. You have to go to the clinic or the nearest hospital or the nearest general practitioner or primary physician. They'll be able to guide you as to the symptoms that you're feeling. Some symptoms are very severe because the stages of the cancer depends on how you present. If you are already in an advanced stage, some may present with fistulas where there's a perforation of the bowel. There's already a hole in your colon where things are oozing because of the tumor. What happens is the colon cancer erodes the layers of your colon. Colon has many layers. It doesn't have just one. You This is how we stage the colon cancer. We stage it according to the AJCC staging, which is a TNM stage. And the TNM stage looks at the tumor, that's the T. It looks at the nodes, which is the N. It looks at the metastasis, which is the M. What is the T? We look at the tumor size. We look at the tumor, how big it is, how many centimeters. Who does this? Who looks at the tumor for us? It is not the oncologist who look at the tumor. When you go to a primary physician, they're going to refer you to a surgeon, and a surgeon will then take a tissue diagnosis and put it in a slide or in a container and send it to the lab. And the doctor called a pathologist will then look into your specimen and read under the microscope. So when they read and analyze your specimen, which is the piece of the bowel or the whatever the or the lymph nodes or whatever the surgeon has dissected, then they will review it under microscope. Then they will give a report called a histology. A histology is a proof that you have a cancer. A histology is also a proof that you have a certain kind of cancer. A histology also is a proof that we use to work out the stage of your cancer. So the histology will then tell us what all these factors. The most important part on the histology is something called lymphovascular invasion, where we looked at is the cancer already spreading in the lymph and into the blood. If there is lymphovascular invasion on your histology, remember the histology is that tissue diagnosis that the pathologist will give, which is a piece of paper with all your details on the analysis of your cancer. Then that histology will then give a doctor the information. If there's lymphovascular invasion, it means the cancer has already started to leak into the vessels and has a potential to spread. This is when chemotherapy is advised. Why chemotherapy? Because chemotherapy is a systemic treatment and radiation is a local treatment. We will not cover the chemo and radiation today because of time. But why am I mentioning the importance of these tests and these processes and the staging? Is because it's important for you to know the stage, even when the doctors are talking to you and they say TNM stage, or they say what's your stage, or you're talking to your family, you need to tell them the stage, understand what the stage means. We said T is tumor size, N is lymph nodes. Lymph nodes are like, I always explain the lymph nodes as like some kind of a rubbish bin of the body where all the dirt goes and pile into. And then all those things that are remaining will then be sent will all be sent into the lymph nodes. The lymph nodes are very important part in the diagnosis of cancer, because once your cancer is spread into the lymph nodes, then the stage changes. The cancer spread into the lymph nodes, it changes your stage. What is the stage? The TNM stage. I hope it's clear. So the N also has different kinds of N's. It's not one N. It depends on what the histology result that you would have been given to tell us what kind of the lymph nodes, how many lymph nodes are involved, are the lymph nodes having the cancerous cells in them, and how many were removed. If they're insufficient, there's a certain number that has to be removed. If your surgeon did not remove the certain number, it then predisposes you as well to an advanced stage. So cancer can be very complicated. It's not one treatment for all, and it's not one diagnosis like flu. Flu is flu. It has no stages. But cancer has so many unfolded components in it. So it's not just one component of a diagnosis. That's why when you ask me about your cancer, I cannot just answer without knowing what the stage is, without knowing the histology, without reviewing the histology. So T, N, and M. M is for metastasis. What do I mean by metastasis? I mean, did the cancer spread out of the colon? Remember, it will spread into the lymph nodes, but also what I need to know is, has it spread outside the colon into other organs? That is metastasis. I spoke of patients, two patients, a 15-year-old who is stage 3B, and I spoke of Chadwick Boseman, who just passed away, who was an actor on the Black Panther, who also had stage 3 disease, which I don't know whether it was stage 3A or stage 3B. Stage 3, all, whether A, B, or C, it does not have a spread into other organs. It means it's M naught. M naught means no metastasis. No metastasis means the cancer has not spread into other organs. Remember, I spoke about symptoms. We mentioned the abdomen, we mentioned the rectal bleed, we mentioned everything. There's another symptom I did not mention because I wanted to explain the TNM stage first, and that is a backache. Sometimes patients will present with a backache because the cancer has spread into the neurovascular structure, which is the nerves. And sometimes cancer can spread into the bone. If it's spread into the bone, if it's spread into the liver, if it's spread into the lungs, that cancer is already a stage 4. If you had breast cancer and now it's in the lungs, then that's stage 4. Unless if it's another primary, which means it's another different cancer altogether. But usually, once it's spread, it's called a metastasis. And this metastasis is what we call as M on the TNM stage. I hope that's clear. Now, for those who are survivors and cancer survivors, I think it's very key that you ask for your histology for your doctor and they show it to you. If you want, you can keep it. I don't see a reason why your doctor will not give you your histology results, because those histology results are your tissue diagnosis of how the cancer is and how it looks like and what are the symptoms. But remember, it's not only the histology that is done to determine your stage. We still need your CT scan, MRI scan to be able to check even further where is the spread has gone into. Because only those screening mechanism, those diagnostic tests can tell us where the cancer is spread to. I won't be able to see from the histology that your cancer has spread into the lung, liver. Only the CT, MRI scan, sometimes basic chest x-ray can show certain signs, but it's not guaranteed, the chest x-ray. So we need CT scan, we need MRI scan. But why is CT scan important as well is because CT scan is also important for radiation later. CT scan is used, but even though the diagnostic CT is different than the one that is done for radiation. In order to treat a patient with radiotherapy, they need to have done a CT scan of certain millimeters in order for that scan to be to produce a treatment plan for that patient. I hope I'm trying the best way to make this as simple as possible. So, in summary, we spoke about the important things that you can prevent yourself at home from predisposing your own self into developing colon cancer. We spoke about diet, we spoke about how you can prevent, how you can increase like fiber in your diet. We also spoke about the importance of reducing the alcohol intake or just stopping alcohol if it's possible. And alcohol binging is also a major problem, but it's not the cause for colon cancer, but it's dangerous for you under circumstances to drink large amounts of alcohol. Smoking, we mentioned. We also spoke in recap about the symptoms that you feel when you have colon cancer. And we also spoke about briefly on staging. We can go into details. The important part about this kind of cancer that we spoke about, which is stage 3 cancer, is this is a tribute to create an awareness. And that stage 3 cancer is the only one we spoke about right now, but it's not the only stage. So we will talk about the stage on other series of these episodes in order to be able to clarify in details about the whole issue of colon cancer. What can you do to check if you have colon cancer? You need to have a colonoscopy. Colonoscopy is a very important diagnostic tool, screening tool to tell. They can also do a field test in being able to check for your to check yourself whether you have cancer or not. So please have a discussion with your doctor. It's very important that you have this discussion with your doctor. It's very important that you go and seek help with your doctor. Colonoscopy is done, like I have discussed, is done in the 40s, but we see a lot of patients who are dying at a very early age, before they even age 40. I hope this was beneficial and I hope this was helpful to you and your family. And I hope you'll take care of yourself. My name is Dr. Thandeka Mazibuko. I care a lot about you. I'm a South African by origin. I currently live in New York City and I will be doing this series. Follow me on my Instagram page, is cancer_dr, or follow me on my Facebook page, which is cancer drnac. And I look forward to seeing you. I look forward to hearing you. There is one message that is popping up. Bushe Pasha says, thank you, Dr. Mazibuko, for sharing such an important information. A doctor that cares offered free cancer screening. May you be blessed. Bushe is from Chesterville in South Africa, in Durban. We did host a cancer screening for Chesterville community in South Africa, in Durban. I lived in that community. I went to the school there. My high school was at Chesterville High School. So we were classmates back then, and we do a lot of work together in advocating for cancer for women and advocating against women abuse. Because it's a very close topic to my heart. Thank you, Bushe. We appreciate your comment. And I hope we see each other on the next live. Take care of yourself. And please know that your health really matters. Is very important. Thank you.